Questions for Dr. Farine, please?
I'm quite intrigued by the long-term steroid study. Because I know nothing about pregnancy, but in terms of steroids, there has been, certainly in the CNS literature, there's been this whole issue, the CHARGE study, showing actually worse outcome CNS-wise from long-term steroid exposure following brain injury. There's a talk 2 days from now looking at spinal cord injury and showing that steroids actually worsen injury. So are you planning on doing any neurodevelopmental analysis on the kids?
It's interesting. I mean, the real issue, we would like to do everything. Mm-hmm. The problem is that you have to bring those kids that are 15 to 18, seduce their parents and seduce them to do whatever you want to do. And we decided that we cannot do it in more than 2 days. So we intend to do some blood work, lots of anthropomorphic measurements, blood pressure. We would like to do more, but I'm not sure that we can. If we find significant findings in any of those, we can actually do it later on. The other issue with these kids are that they are 13 to 18. So it's a very problematic age in terms of recruitment.
Although, if they're 13 to 18, they will be in school, so you'll know their school. You could just ask a general question about school performance. And the other issue is for things like ADHD and things, you should have at least. It might be worth just asking a question or two. Just mention.
No, let's make it clear. First of all, we do intend to do a variety of tests to see how they function. So it's going to be IQ, it's going to be school function, and so forth. The real issue is more to what extent you can do actually stimulation and suppression tests on the different hormones, and we are a bit limited there. But if we have positive findings, it will be a very good basis to do it on the long run. If we have negative findings, it's going to be a major issue because I didn't have enough time, but those kids were exposed to mega dose of steroids from the 8th week of pregnancy till birth. And if it's going to be a negative study, you can be assured that steroids in lower dosages for shorter periods, like what we use for lung maturity, which is 1 pulse or 2 pulses or 3 pulses, if we show that this was safe, it's going to be really safe. On time.
One more. Dr. Korn?
Can you make a general comment about where you guys are moving with, where things are moving on academically on getting better delay of delivery by retarding delivery, which is a major issue to prevent or diminish prematurity?
Prevention of preterm birth is a really problematic issue. The data from the States shows that it's going up for a variety of reasons. The data from Canada shows that it goes up mainly because of multiple pregnancy, mainly because of the way we induce pregnancies in women in couples that are infertile. We are doing there are different ways to deal with it. One approach is actually to change regulation. For instance, we just ratified yesterday between the SOGC, the Canadian Fertility Society, and guidelines of how many embryos you should put back in utero in women at different age groups. So we will not have triplets, quads, and this by itself will reduce the impact of this thing in a major way. There is basic research. Steve Lai is looking now at genes that are activated in labor in general and preterm labor specifically. So this might be the answer on the long run, all these gene cassettes. In terms of drugs, actually, it's quite disappointing because in the last SGI, a few weeks ago in Toronto, there was a large study that came from Kingston looking at nitroglycerin as a drug to treat preterm labor, and it was a negative study. And right now, the only drug that seemed to be sort of effective is indomethacin, and you cannot use it after 30 weeks. So this is a major problem, especially since this condition accounts for 80% of the mortality and the morbidity.